Your brain controls movement, memory, vision, speech, and countless processes happening throughout your body. Inside it, billions of specialized cells communicate constantly to keep the brain functioning. Every cell follows biological instructions that control when it grows, divides, repairs itself, or stops. But sometimes, changes in a cell's DNA can disrupt these carefully controlled processes. If those changes affect growth control, a cell may begin multiplying when it shouldn't. That abnormal cell can continue dividing, producing more abnormal cells inside the brain. As these cells accumulate, they can form a mass known as a tumor. But having a brain tumor does not automatically mean a person has cancer. Some tumors are benign, while others are malignant and can behave more aggressively. Because the brain controls so many functions, where a tumor develops can make a major difference. The brain sits inside a rigid skull, leaving very little room for anything that grows. As a tumor grows, it can occupy space that the brain normally needs. That added pressure can interfere with nearby brain tissue and the functions it controls. That's when symptoms can begin appearing in everyday life, depending on where the tumor is located. For some people, persistent or worsening headaches can be one of the symptoms. Depending on the situation, increased pressure in the brain can also contribute to nausea or vomiting. A tumor affecting visual pathways can sometimes cause blurred or changing vision. If areas controlling coordination are affected, everyday movements can become less steady. A tumor near language areas can sometimes make speaking or finding words more difficult. Some brain tumors can disrupt electrical activity and trigger seizures. A tumor doesn't have to be large to cause problems. Its location can matter just as much. Some tumors remain contained, while others can grow into nearby brain tissue. As some tumors grow, they can stimulate the formation of new blood vessels to supply them. Brain tumors are not all the same. Their behavior can vary greatly from one type to another. When unusual symptoms persist or worsen, that's when medical evaluation becomes important. A doctor may first check reflexes, coordination, vision, strength, and other neurological functions. If more investigation is needed, brain imaging can reveal what is happening inside the skull. An MRI can reveal the tumor's location, size, and relationship to nearby brain structures. Doctors can then study these images to understand the tumor and plan what to do next. In some cases, doctors examine a tissue sample to determine exactly what type of tumor it is. Once the tumor is identified, doctors consider its type, location, size, and behavior before choosing treatment. Treatment depends on the tumor, and sometimes several approaches are combined. When possible, surgery can remove as much of the tumor as safely possible. Radiation therapy can use focused energy to target tumor cells while limiting exposure to surrounding tissue. Depending on the situation, medicines may also help treat the tumor or manage symptoms and treatment effects. After treatment, follow-up scans can help doctors monitor what is happening inside the brain. Doctors can compare new scans with older ones to see whether the tumor has changed. With appropriate care, many people continue living their lives while receiving treatment and follow-up care. A brain tumor's future depends on factors such as its type, location, growth rate, and response to treatment. That's why continued medical follow-up can be an important part of managing a brain tumor. Because every brain region has a different job, the effects of a tumor can vary from person to person. Persistent or unusual neurological changes deserve attention, especially when they continue or become worse. Modern imaging and laboratory testing give doctors powerful tools to identify and understand brain tumors. The most important point is that brain tumors are diverse, and their effects and treatment can be very different. Understanding the warning signs and getting concerning symptoms evaluated can make a difference. Your brain is worth protecting.